I first learned of cannabis back in 2010 in the state of Nevada. I've been a registered nurse at UMC Children's Hospital back in the 90s and even at Sunrise Children's. During that time, I was even considering coming up and working at Reno. You guys have your wonderful children's hospital up here. But at that time, I became sick. So cannabis is my medicine. And a lot of people don't understand that, but it's done some amazing things in my life and through children. And one thing I didn't realize is when cannabis was first introduced to me and said, "Hey, Jules, did you know that cannabis can cure cancer?" I'm like, whoa, that's like a very bold statement. But it did one thing for me. It got me to go home and start Googling, because it is an amazing plant, and we don't use it in the hospitals. I've worked with many children over the years. And one of the most important things that I've discovered is children, they're our future and actually deserve the same beneficial rights as any other human being on this planet. We know that cannabis aids in bringing balance within our bodies and is a key to our future in health and wellness. But did you know that now is the time to learn why it's important to include your kids? I always say, kids are our future. We're not always going to be here, but the good news is they will, and we have to give them the best beneficial start that we can possibly can. Some of the things I want to go over with you today are children and medical cannabis. The controversy is it right for your child? How many people have a child, know people that have children? You might be a grandmother, a mother, a father, a grandfather. I know, there should be more hands for people related to children in this room. There you go. All of us are somehow connected to our children, and we are responsible for teaching them the most things. So we're going to talk about that. We're also going to talk about the current laws for children here nationally and even here in Las Vegas, I'm from Las Vegas, but here in Nevada, and anecdotal case studies. And we are part of Cannabis Nurses Magazine, where we have actually gone through in our July-August issue and discussing some of the presidential cases that we've had. And also, I have a lot of patients and parents that come to me and say, well, what do we look for in pediatric care with your physician? So we'll be going over those important things. So Nurse Heather, you did a phenomenal job in showing us what the endocannabinoid system is. It's our connection system. We actually have a balancing system. And we now know, as we've gone through the previous lecture, that all mammals, humans, have an endocannabinoid system. I, you, and yes, your child. We also discussed in detail some of the items and conditions that cannabis can actually beneficially help us. So many of you in this room are probably already consuming cannabis or utilizing cannabis for one of the many ailments that you probably see up here. But did you ever consider the fact that your children also might have these same conditions? And since we all have an endocannabinoid system, why aren't we giving them the same beneficial value and a fresh start as we? So it is effective for our kids too. One of the interesting things is working in the ERs over my life with children is we have all these medications that we put in these tiny little bodies. And they're like, well, Nurse Juhlzie, we can't give this to the kids, it's just not safe. We don't have clinical trials on it. But then I also mentioned too, how many annual deaths do you have with cannabis compared to tobacco, poor diet, alcohol, aspirin? And I laugh because I even say that cannabis is safer than peanuts, because you actually have higher incidence of children aspirating on different things, and cannabis yet is the safest, I believe. When parents come into the ER and their child has been seizing over 100 times a day, and I get really emotional because these poor little kiddos have these toxic chemicals, opiates, benzos, you name it. And when they come into the ERs, they're helpless, they're relying us on medical providers. What do we do? Well, naturally, parents are challenged. They're saying, here, we have to give your child these benzodiazepines. This is the little black box warning. Some of our pediatric parents and mothers, I know Colton, I'll be talking about him a little bit later, his mother always said, oh my gosh, I had all of a sudden all these little black box warnings, I have to like sign my child away, you know, this is the only last resort, but these are methods of treatments that we use every day, and they naturally just sign their responsibilities away to be able to have these federal agencies with the highest warning. So a lot of people don't know this, but these actual drugs that we put into these little bodies, most drugs prescribed for children have not been tested in children. We have clinical trials for adults, but we do not have clinical trials for children. And why would we? We don't want to put kids through an unknown drug that could be possibly unbeneficial to them. However, because these are the only solutions that we have as a treatment options in the normal medical profession, there is no demonstration of safety and efficacy in adequately well-controlled clinical trials. However, we are still administering these drugs to our children.